good benefits. And if you're below the poverty level, for now, the dental coverage is included among the benefits. Although I should say in Governor Patrick's budget proposal for next year, because of the huge shortfall that the state is experiencing, the proposal is to ease back on the dental benefits and to reduce some of the scope of some of the benefits. If you have a higher income, it looks more like private insurance. There are premiums that have to be paid on a monthly basis. Those are on a sliding scale. There's still no deductibles, but they have copays also on a sliding scale that look like the kind of copays you would get in commercial insurance. And the benefits are still the broad scope of benefits, but without dental coverage. This is a chart of the enrollment growth in Commonwealth Care. As you can see, it was very successful growth. The take-up rate in the beginning was really steep. And in fact, state officials, and Melissa knows, she lived through this, were quite worried when they were in the steep part of the chart. Is this ever going to end? But as you can see, it did end. It leveled off, and it was pretty flat after the first year and a half or so of growth. The big drop there right before the last 4 months ago, that was when a group of legal immigrants, legal, not illegal, but legal immigrants, were removed from the Commonwealth Care Program, again because of state funding shortfalls, and put in a separate program called Commonwealth Care Bridge with higher co-pays and less benefits, a little bit less benefits, and a little bit higher cost sharing, and a more limited network. So those people are still getting some kind of coverage, although it's lesser coverage. That's about, it's about 25,000 folks in that program. So that's what we have in Massachusetts. The Washington bill has, they call them tax credits rather than premium subsidies. And the effect will be the same, but it allows the president and all the political leaders to say this is a huge tax cut, because the way we're providing benefits for people is through the mechanism of tax credits. But the tax credits are refundable, meaning you get the tax credits even if you don't owe any taxes, and they're payable in advance, so you don't have to wait until April 15th of the next year to get your tax credits. So it's the federal mechanism of providing subsidies. In Massachusetts, they decided not to use the tax credit route. They just subsidized the premiums directly, but the effect is the same. The tax credits in Washington will be for family coverage, while in Massachusetts it's only for adults. It goes up to 400% of the poverty line. So that's a higher than we do in Massachusetts. We go to 300%. So for our state, that means about, it's hard to guess, but we think maybe 70 to 80,000 more people will be able to get help than we're helping right now. Again, the coverage is comprehensive. The premiums that are proposed in the Washington bill are higher than we charge right now in Commonwealth Care. And that's going to require the state to figure out what we do about that. Nothing's been decided yet, but that's definitely going to be an issue. So that's number two. So number three are the insurance market reforms. Now, a lot of the horror stories that was part of the debate in the national debate for the last year, we never had in Massachusetts. And I just want to make sure everybody understands that. We already had guaranteed issue, guaranteed renewal, meaning that you can get your insurance without asking about your medical status. We didn't have gender discrimination. But most states did have those issues. So those reforms we didn't need, but the reforms we did need is letting individuals basically take advantage of group rates, and that brought the price down about 30–40%, and letting kids stay on their parents' plans up to age 26. We do that only for 2 years. The Washington bill lets people stay up all through their 26th birthday, and that's a really huge advantage for folks. We also tried to make the insurance market a little easier for folks. We set up this program called Commonwealth Choice, which lets people basically shop for insurance the way you'd go to Expedia or to shop for travel. The website is nicely set up. You put in your age, you put in your zip code, and it tells you exactly what programs, what insurance products are available for you, and you can do some rational comparison shopping. The bill in Washington delays a lot of those insurance reforms for 3 to 5 years, but sets up a high-risk pool. There's also a requirement that we don't have in Massachusetts, that most of the money raised by insurers go to benefits. There's also a requirement that rate increases be approved, and this 3-to-1 age ratio. That means the oldest person can't be charged more than 3 times what the youngest person is charged. We have in Massachusetts, we've had for a long time, a 2-to-1 ratio. So there's going to be a little bigger spread of benefits in the national plans. Then the last 2 things are what we call individual responsibility, the individual mandate, and the employer assessment, employer responsibility. So for individuals in Massachusetts, the requirement is that adults over 18 have to have insurance if it's affordable and if it meets the creditable standards, which is how much insurance is enough. It's enforced by tax penalties. In the federal bill, it's very similar, but applies not just to adults but to everybody. There are similar exemptions for affordability, although they're somewhat different, which I'll explain. And the penalties are phased in. They start off lower than our current penalties, but they'll be higher, the penalties for not having insurance. This is the chart that the state connector, which is the new agency, came up with to figure out how much insurance can people afford. These are the charts that get converted into our tax forms when you fill out the Schedule HC when you're doing your taxes in Massachusetts. So you can see it's a sliding scale. If you look on the right, the percent of income that people are required to pay. In the federal bill, it's not a sliding scale at all. It's a flat 8% of income is deemed affordable. So that's a quite big difference. The national bill assumes much greater ability to afford coverage than what the connector decided in Massachusetts. And that, again, is going to have to be worked out, the interplay between the 2 systems. And then finally, creditable. What is creditable? The state put a limit on deductibles, a limit on out-of-pocket expenses. They require some preventive care. They require that drugs be included. Similar requirements are in the federal bill. One of the changes from what we have is a requirement that there be no cost sharing at all for preventive care. Cost sharing means co-payments or deductibles. So all of those will be covered with no co-payments when you get preventive services. And then finally, the employer responsibility. In Massachusetts, if you have 11 or more workers, you have to pay this fair share assessment of $295 per worker per year if you don't offer coverage. In the federal bill, it's more than 50 workers, and it's $750 per FTE if any workers are getting assistance through the program. So again, there's going to be some conflicts between the federal bill and the state bill that's going to have to be worked out. So the last thing I want to say is, this is what we have in Massachusetts, and this is what the federal bill sets up. The point of this picture is it's not exactly a coherent system, but on the other hand, it does seem to work in the American context. And whether this thing is balanced right or not is something that we can talk about. I think the most important lesson, I have some lessons here to talk about, but the most important lesson is implementation is everything. And we have had 4 years of Massachusetts implementation. I think we have a lot of lessons for the national implementation. How it's implemented is as important as what gets passed. And that's the thing that we're all going to have to be involved in. So that's my presentation, and we'll do questions at the end of everybody.
Yes.
But thank you so much, and I hope I've learned a little bit about this.
Thanks, Brian. That was great. Thanks, Brian.